You.
You're up.
Good afternoon. My name is Lori Smith, and I am the Kennebunkport Town Manager, and today is Tuesday, April 21st. I appreciate you guys taking a few minutes to check in with us today. We wanted to update you. Over the past few weeks, we've been doing these weekly check-ins, and our goal is always to communicate regarding the town's response to COVID-19 and let you know that we're here. We hear your complaints, your concerns, your worries, and we're working on these issues each and every day. Last week, I spent some time discussing the next step, a reentry plan. We had some technology issues there. Late last week, the White House released guidelines for opening up America again. The plan outlines a three-phased approach to be implemented on a statewide or county-by-county basis at the governor's discretion. There are no timelines or dates associated with the phases, but rather an examination of data points to determine if a phase is warranted. According to the criteria, a state or county must see a downward trajectory of influenza-like illness reported and COVID-like cases within a 14-day period, a downward trajectory of documented cases and positive COVID tests within a 14-day period, and hospitals need to be able to treat all patients without crisis care and have a robust testing program in place for at-risk healthcare workers, including antibody testing. So there's a lot that has to be met. When will we be ready for phase one? This is up to the governor and Maine CDC. But it is clear from our current statistics that we do not meet the criteria to begin phase one. But I am hoping there is light at the end of the tunnel. To be clear, in all three phases, individuals are still expected to maintain good hygiene practices and stay at home when feeling sick. Employers are expected to maintain standards for social distancing and protective equipment, sanitation, and temperature checks. It is not until phase three that vulnerable individuals are no longer guided to shelter in place and directed to resume public interactions, although they should continue to practice physical distancing and minimize exposure to social gatherings where distancing may not be practical. One of the big questions is how large venues and events will be handled through the phasing. The language in the plan states that in phase one, they can operate under strict physical distancing standard protocols. In phase two, they can operate under moderate physical distancing protocols. And finally, in phase three, they are allowed using limited physical distancing protocols. There are no definitions to strict, moderate, or limited. I personally find this interesting as bars, schools, and organized youth activities are not opened until phase three. So in a new world with no guarantees, what can we take away from this document? We know that we aren't curing COVID-19. Without a vaccine, life will continue to be challenged in terms of physical interactions, sanitation, and health care. I think most people agree that we do need a phased approach. As I mentioned last week, Newton's third law is for every action there is an equal and opposite reaction. Each step we take out of the pandemic will need to be weighed and measured to understand the effect before another action is implemented. Summer in Maine is marked by lots of time socializing outdoors together. Cookouts, time at the beach, exploring new places, parades, festivals, concerts. How will the summer of 2020 be different in our new world? I know that we are not alone in navigating these waters. The Yarmouth Clam Festival recently announced that their July event has been canceled. Bath Heritage Days has informed the public that they will not be holding their annual 4th of July celebration. And today, Maine State Music Theater announced that they have canceled their 61st season. All of these were difficult decisions to make, but they were made with an eye on public health and safety, understanding that large crowds and venues will struggle while maintaining physical distancing and public health. The Board of Selectmen will be discussing our reentry plan this Thursday night at 6 p.m. As we plan for the summer and year ahead, we will include thoughts from various groups in our community and work with our neighbors so that we can do our best to balance public health with the needs of our residents and businesses. Another challenge coming up is our June town meeting. The governor has changed the primary from June to July 14th. Although we normally hold our annual meeting on the second Tuesday of June and the following Saturday, this year, an election will be difficult due to concerns with COVID-19. For reasons of public safety and in accordance with the governor's actions, we should probably move our meeting dates to July 14th and 18th. In order to accomplish a secret ballot warrant for July 14th that adjourns to an open town meeting on the 18th, we will need to authorize a warrant and all budget articles by May 15th. That would require that we quickly gear back up into our budget discussions and process with the Board of Selectmen and the Budget Committee. The Selectmen will be discussing the budget and election challenges and the process we will use this evening, tonight at 6 p.m. Once I receive direction from them, my staff and I will move forward expeditiously to meet whatever timelines are required. At this point, I'm going to turn it over to Allison Kenaway for her public health update.
Good afternoon. My name's Allison Kenaway, the Director of Public Health here in town. And I hope everyone's staying healthy. It sure has been a long April. March and April all join into one long month of social isolation. But we've done it. We've isolated and we've lessened the curve, and we have lessened the burdens on the medical facilities here in Maine. But we're not done yet. As we continue for a few more weeks, possibly, of staying at home, social distancing, and slowly emerging back into our communities, back to work, back to seeing friends, relatives, going inside buildings, we must remember all that we've learned in the past few weeks. We must cover our coughs, wash our hands for 20 seconds with soap and water or sanitizer frequently during the day. We must continue to clean frequently touched surfaces at our homes and our workplaces, not touch our faces, eyes, nose, and mouth unless we've just washed our hands. We must remember to stay at home when we are sick. Remember, this is a virus that is spread by droplets from breathing, coughing, and sneezing. This is not only for the coronavirus, but also influenza, the common cold, and many other viruses that we see all winter long. As we start getting back into our communities, it is thought that we might see another round of coronavirus surge through our communities. This is a possibility. The symptoms will remain the same: a fever of 100.4 or greater, shortness of breath, sore throat, cough, fatigue. Symptoms may appear anywhere from 2 to 14 days after exposure. Remember to please call your primary physician to report any symptoms and get direction for the next step prior to just showing up at the emergency department. If you are in the high-risk category, older adults and people of any age with underlying medical conditions, please remain vigilant. Keep yourself safe by doing everything that we've just talked about, along with asking for help from others. We are here to help you. Don't take unnecessary risks. Now that the weather's getting nice, the sun is big and bright, and the days are getting kind of warmer, not today, but the birds are out, the peepers are peeping. Please take time for yourselves to get outside and get fresh air, exercise, and soak it all in. It's good for the mind, good for the body and the soul. For the most up-to-date information on how the state of Maine is doing in this pandemic, please visit the Maine CDC website. There's a lot of information there, along with daily updates from Dr. Shaw. If you haven't turned into his daily updates, you probably should. He's very informative and smart. And I'd like to quote Dr. Shaw from his Friday CDC update. I think many of us right now are grieving not only the lives of Maine people who we've lost, but also grieving the lives that we ourselves used to have not too long ago. Our personal remembrances of things past, the hobbies that used to define us, the habits and haunts that we used to enjoy. For many of us, those have been replaced by nothing. And I think for a lot of us, we're collectively grieving that loss. that rapid, sudden change. And so what do we do about it? Well, the first to me is to recognize that grief is not a problem to be solved. It's a feeling to be reckoned with and discussed. For me, weathering those uncertain times entail acknowledging and grieving the routines that we've all lost, and then creating new ways and new routines to move forward. But the second thing for me is to talk to somebody, and I have asked each and every one of you to do the same, to reach out to somebody. So remember, you're not alone in all of this. There's people all around to help you, from friends, family, neighbors, 211 and the crisis hotline at 1-888-568-1112. Both 211 and the crisis hotline are available 24 hours a day, 7 days a week. And I just wanted to touch base on this. Maine Municipal Employees Health Trust sent out a list the other day on how to help cope with anxiety and stress during the COVID-19, and I'd like to share it with you. The first one is to stay calm and carry on. Maintain a routine and continue your normal daily activities while continuing to practice prevention. The next one is stick to reputable sites for your information. There's a lot of misinformation out there on the web, and as I've always said, stick to the Maine CDC or the National CDC for the most accurate information. The next one is use coping skills. Try to focus on relaxing more. Exercise, practice yoga, meditate, and use deep breathing exercises like taking a walk. The next one, stay informed. Not only getting your information from reputable sources, but limit your exposure to information. Too much information can overwhelm you. Be prepared. Make sure you have enough supplies at home, medicines, food, and toilet paper. And the last one is ask for help. Monitor yourself, your emotions, and your internal responses. If you feel that you cannot stop worrying or notice any concerning behaviors, please ask for help. These are all great suggestions for dealing with COVID-19 stress and anxiety. And then I just wanted, lastly, to update you on food insecurity. Community Outreach Services continues to provide foods to families in need in our communities. And if you're in need of food, please call the General Assistance Office in your town for assistance. For Kennebunkport, that's 967-4401. Friday morning food pantry continues at 9 a.m. and continues until the food is gone. This is a drive up and pick up with no prior call to order for this service. Just show up at Vinegar Hill in Arundel and follow the direction of the volunteers. Community Outreach Services has now added a second day of the week for their food pantry. Starting today at 5 p.m. from 5 until approximately 6:30 or until the food is gone, there's an evening food pantry option. It will be the same as Friday morning. It will begin at 5 and go until the food is gone. You will drive up and pick up and no need to call in advance. It too will be at Vinegar Hill. This is for families who are unable to attend the Friday morning food pantry. Please plan on attending one or the other, not both. Thank you. Thank you to Community Outreach Services and all the volunteers and our community donations that have allowed this to happen. If you would like to donate to COS, please do so on their website at coskennebunks.org. You select the support button and then the donate button, or you can send checks directly to them at COS, P.O. Box 1175, Kennebunk, Maine. And RSU 21 is continuing with the breakfast lunch bag services for students upon request. You can access this service by visiting the RSU 21 website. Click on the food services and then Ellen Demmons and send her an email to make a request. And lastly, if you're a senior or medically fragile person and need help with shopping or errands, please call Kennebunkport Public Health Office to make arrangements, 967-4401. Thank you.
Good afternoon, Kennebunkport. Again, my name's Craig Sanford, Chief of Police and also the EMA Director. I'll be brief today because, everybody's kind of saying the same thing. So again, all emergency services are functioning under current COVID-19 precautions. Again, I appreciate not calling for every little thing in the world, and because it's important for us to conserve our personal protective equipment. Again, I thank for those donations, very thankful for those. And if you have any more lines on any of that stuff, please let us know, and we'll be happy to find a home for it. Just to let you know, we're starting to see an increase in speeding vehicles. I would assume it's because of the light traffic volumes. And we're seeing a lot of folks violating the hand-free laws. So I want you to please ensure that you follow all state laws. And it's important that you pay attention when you're driving. And again, follow all of the associated laws when you're driving. I want to stress we are still under an executive order from the governor that to quarantine for 14 days upon returning to Maine. So if you're coming back up here for the first time, make sure that you are quarantining for 14 days. It's still a requirement, and we want to make sure that people are being safe. And ensure that we're keeping our 6-foot distance currently still. It's not over with yet, so it's important. Please start thinking about what you might need once we are over the hump and we start to move back into so-called normalcy. Will you need to have a face covering when in public or when you go to work? These are things that you can start planning for while you're sitting at home and kind of bored. Will you need to adjust your work or shopping routines? You know, if you're an older citizen, you might need to go earlier or later. And then, you know, with kids and things, are you going to have to adjust it so you can get some help and make sure that those things are to alleviate some of the crowding? Well, you need to adjust your vacation plans. You know, we just don't know right now if things are going to be open or how they're going to be open or limited spaces. So you might want to start thinking about that and maybe making some phone calls. And you're going to have to register your vehicles. You're going to have to pay vehicle insurance. You're going to have to renew your licenses once this restrictions are lifted and, you know, these state offices come open again. So start thinking about these things and don't let them lapse. And I just want everybody to realize that everything we did in 2019 will probably be altered in some way for the foreseeable future. Thinking and planning for these changes can hopefully reduce some of the stress in the future, because all of us can feel that stress. Remember, these changes are no one particular person's fault, and any deviation from the way things used to be is for everyone's best interest. Thank you.
So thank you, Allison and Craig. As I look at my grateful list, remember we talked about gratitude last week. I hope that you are all thinking about things to be grateful for. It helps us get through these challenging times. I am certainly grateful for Allison and Craig, as we would not be where we are today without their assistance and their everyday guidance and support. As I looked at things to be grateful for, you know, this past week, I have seen that people have really reached out to some old friends, you know, whether it's catching up with some college friends that you haven't seen in decades, or whether it is healing some challenges with your family members that maybe were estranged. I've seen a lot of kids learning how to ride bikes on the social media posts as parents have had some time to spend with their children. I've seen a lot of thankfulness for college students who had to come home, or high school seniors who had plans canceled, but parents who are grateful for a pause and a moment to spend with these young adults who will soon be out of the nest. So although these are very challenging times, please continue to look for the good that's happening around us, for the support and volunteers that have come forward, and for the love that I see every day in our community. So one way that I can be adding to my grateful list is if more of Kennebunkport residents were able to respond to the census. You'll remember a couple of weeks ago, I told you all about what our census response rates were. And our response rates were below the state of Maine and below our neighbors. I checked our response rate this morning, and as of April 19th, our response rate was at 26.6%. This is still well below Maine's average of 41% and our neighboring towns' rate of 48 to 49%. One thing I have learned since our last discussion is that the census does not mail questionnaires to P.O. boxes. In their words, the census is all about counting people where they live and sleep, so we must tie each form to a physical location. P.O. boxes are not tied to specific housing units, so we can't use them to send the forms to specific housing units. There are many Kennebunkport households who do not use P.O. boxes. who do use P.O. boxes. So if you didn't get a census form, please don't take it as a sign that you shouldn't respond. Please go to 2020census.gov and fill out your form. It should only take 5 minutes. If you need assistance by phone, you can also dial 844-330-2020. That's 844-330-2020. So continue to stay tuned as we work through these issues. You are all doing great. Remember that warmer weather is coming, and with that will be the added challenge of physical distancing. Keep up the good work, and I know we can all make it to the other side together. Be well and be safe.